It's 104.8 Channel 4. You go, Sean here hanging out this afternoon, and we're going to talk about something very important now, and it's something that a lot of people suffer from, allergic rhinitis, which is also known as hay fever. And here to tell us all about it from Prime Hospital is a specialist, Dr. Mustafa Hatim Mahesri. Doctor, good afternoon to you.
Good afternoon.
Okay, so let's just go straight off the bat, Doctor. What actually is allergic rhinitis or hay fever, as it's more commonly referred to?
Is basically allergic inflammation of the nose. It causes troublesome symptoms like nasal blockage or congestion, sneezing, itching of the nose, and even watery eyes.
I know a lot of people that suffer from this, and it really does get them down. So can you talk us through some of the signs and symptoms of hay fever?
The symptoms may not necessarily be in the nose, but the nasal ones are more important, such as nasal congestion, itching of the nose, sneezing, which can be troublesome, a runny nose, also known as rhinorrhea. Allergic rhinitis can also affect the eyes, the throat, and even the chest. When it's known as allergic asthma, we have symptoms like itchy and watery eyes, then itching of the throat. Some people even have itching of the ears.
Can you talk to me about some of the lab tests? What are the lab tests when it comes to hay fever or allergic rhinitis?
Yeah, that's a good question. So in the testing, the most important test is the skin prick test, where we actually prick the patient's skin with the well-known allergens of the area. And then once we find what the allergen is, we can treat the patient much better because we're going to treat the cause. If we are not able to do skin prick tests, like if it's a child or he has severe skin allergies and eczema, then we do a similar test called the blood test for allergies, which is also called allergen-specific IgE testing. In some children, we need to take x-rays of the adenoid, and sometimes we also need to do CT scans and x-rays of the sinuses to rule out polyps.
It is a very common issue, and I know that a lot of people listening are suffering with these. I want to take a little break, Doctor. I want to come back. I want to talk about some of the triggers and also some things that you have to avoid if you do suffer from this. Are you okay to stick around for another 5 minutes?
Yeah.
Fantastic. We're going to talk more with the doctor right after this at 104.8 Channel 4. 104.8, it is Channel 4. You go, Sean here hanging out this afternoon, and we're talking about something pretty important right now, allergic rhinitis, which is also known as hay fever. Now, we just went through some of the signs and some of the symptoms, and we've got a specialist from Prime Hospital, Dr. Mustafa Hatim Mahesri. I want to talk to you about some of the common triggers for hay fever.
The most common trigger or cause of allergic rhinitis in this country is the house dust mites. You know, there are small mites which live in the bedding, in the carpets, in the curtains. They're called house dust mites. And also pets such as dogs and cats. Then we also have fungi or molds, which are seen in wet areas like the kitchen and the bathrooms. And, of course, pollen from the trees, from the grass.
And can you talk about some things that people should avoid when they do have hay fever?
If you look at the food that can cause allergic rhinitis, you should try to avoid, carbohydrates, carbs, such as white bread, pastries, cakes, etc. Then you should try to avoid fried foods like French fries because they have a lot of additives and coloring agents. Of course, sweetened beverages like sodas and, soft drinks, as they call it. Even the energy drinks, because they have a lot of additives. Sometimes red meat, processed meat, and even, the fat-laden breads like butter or margarine. These are the foods you should avoid. Some people, if they're allergic, they are more sensitive to cold air and also tobacco smoke or the kitchen smoke, sometimes even freshly painted rooms or houses. So you should try and avoid these things.
Now, there's something called the rule of 4 when you're managing hay fever or allergic rhinitis. Can you talk to me a bit about that?
The first thing in the rule of 4 is avoidance or environmental control, meaning if they're allergic to dust mite, they have to avoid places having a lot of dust and control the environment by using HEPA filters in their vacuum cleaners, etc. Number two is the drugs that we administer, the medicines that we give to patients, such as antihistamines, leukotriene antagonists, such as Montelukast, intranasal steroid sprays, saline sprays. Three is something called immunotherapy or allergy shot or allergy vaccine, which is now also available in the oral form. It's a sublingual form where you can put it below the tongue, available in solutions or tablets. The fourth one is surgery. In fact, most of the cases of allergic rhinitis are hay fever.
Dr. Mustafa Hatim Mahesri, you have been very informative, and I thank you. For people who are listening out there who are suffering from some of these symptoms, just know that there are a lot of options. Doctor, thanks for the chat this afternoon.
Thank you. Thank you for inviting me.
It's 104.8, Channel 4.